A very good afternoon to everyone. Myself, Arpit Kamal, nursing tutor, Rama College of Nursing. Okay, so today we will deal with the topic nephrotic syndrome. Okay, our today's topic is nephrotic syndrome. Whenever we heard the word like nephron or nephrotic, it is somewhat related to kidney. Okay, what is kidney? Actually, kidney is a bean-shaped organ which is situated in the abdominal cavity. Before proceeding with our topic, that is nephrotic syndrome, we should know what is the main functions of kidney. Okay, first I will tell you what are the main functions of kidney. The first and main function of kidney is filtration. What kidney does, that the products which are not in the body, okay, that are filtered through the kidney. Reabsorption. Okay, reabsorption of water which takes place in the kidneys. Next one is hormonal balance. Hormonal balance. Next one is acid-base balance. Okay, so first function is filtration. Filtration means whatever the unnecessary things are present in our body, that is filtered through the kidney, which are not needed in our body, and in the form of urine. Then second function of kidney is reabsorption. Reabsorption means things which are filtered, but even though they are necessary or they are needed by our body, okay, those things are reabsorbed through kidney. Next one is hormonal balance. Okay, kidney plays a major role in regulation of the hormone. Next one is acid-base balance. Kidney has a major role in maintaining the pH levels. Okay, the last one is blood pressure regulation. Okay, the kidney main function is also maintaining the blood pressure. So we will begin with the topic nephrotic syndrome. What is nephrotic syndrome? Nephrotic syndrome is a collection of symptoms due to kidney damage. Okay, syndrome means collection of symptoms. Here what symptoms will be there? It includes protein in the urine. Okay, what is there? Protein in the urine. The next symptom in the nephrotic syndrome is low albumin level, low blood okay. So what symptoms we can see in nephrotic syndrome? Protein in the urine means urine will be present in the protein. Next one is low blood albumin level. Okay, albumin is also a type of protein. So here in nephrotic syndrome, what happens? This albumin will be reduced in amount in the blood. Then there will be high blood cholesterol level, or either we can say high blood cholesterol or lipid level. Okay. Then there will be generalized body edema. Then we will see the characteristics for the nephrotic syndrome. What will be the characteristics? Okay, here protein in the urine is known as proteinuria. Okay, next one is low blood albumin levels. Okay, low blood albumin levels means hypoalbuminemia. Okay, then there is high level of blood lipids, that is hyperlipidemia. Then there is edema. Okay, so this was all about introduction about nephrotic syndrome. So we have seen the characteristics of nephrotic syndrome. First one is proteinuria, means protein in the urine. Next one is hypoalbuminemia, means presence of albumin, okay, low level of albumin in the blood. Next one is hyperlipidemia, means high levels of blood lipid. The next one is edema. Okay, so this is the characteristics of nephrotic syndrome. Next we will see with etiology. What can be the etiology for nephrotic syndrome? The first etiology is bacterial infection. Okay, bacterial infection, mainly staphylococcus infection. Okay, okay, so what can be etiology for nephrotic syndrome? The first etiology is bacterial infection. Okay, any bacterial infection may lead to the nephrotic syndrome. Mainly it occurs due to staphylococcus infection. Okay, next another cause is obesity. Okay, next another cause can be glomerulonephritis. Glomerulonephritis means inflammation of the glomerular capsule, which is situated in the kidney. Then it can also occur due to certain use of drugs like steroids and penicillin. Then another cause can be systemic diseases such as diabetes mellitus, leukemia, then renal disorders like nephritis, okay, glomerulonephritis and chronic kidney disease. Then another cause can be cardiac failure. Okay, so these are the etiology for nephrotic syndrome. Next we will see pathophysiology. So now we will see for the clinical manifestations for nephrotic syndrome. Okay, first one is proteinuria. Okay, means there will be presence of protein in the urine. Next one is hypoalbuminemia, means low level of blood albumin. Then there will be hyperlipidemia, means high level of blood lipids. Then will be edema, means generalized swelling in the body. Then there can be hypertension, increased blood pressure. Then next can be ascites. Ascites means collection of fluid in the abdominal cavity due to change in the osmotic pressure. Okay, next one can be malaise. Malaise means muscle pain. Then the person can also have weight gain. Okay, so we have seen the etiology, pathophysiology and clinical manifestations for nephrotic syndrome. Now we will see how we can diagnose this. Okay, so for the diagnostic evaluation, first we can go for the palpation. In the palpation, kidney will not be palpable. Okay, in the palpation, kidney will not be palpable because the client having nephrotic syndrome having edema or ascites. Due to that, the kidney will not be palpable. Then also can go for the urine analysis. In the urine analysis, we have to mainly see for the hematuria and proteinuria. Okay, hematuria means presence of blood in the urine. Then proteinuria means presence of protein in the urine. Then another test, the person can also go for the blood test. In the blood test, we will major findings will be increased level of serum creatinine, increased level of serum protein, increased level of serum cholesterol, and increased level of blood urea nitrogen. Then another, the person can also go for the renal biopsy, renal ultrasound, and renal X-ray. Okay, we will see some values. Okay, albumin is also a type of protein. Okay, so normal albumin level is 3.5 to 5 gram per dl. Okay, that is the normal value. But here in nephrotic syndrome, what happens? Albumin levels reduces. Okay, so here it will be less than 2.5 gram per dl. Okay, same as cholesterol. The cholesterol normal value is less than 200 mg per dl. Okay, that is normal. But in this condition, the value increases more than 200 mg per dl. Then in the blood test, we will see the normal values for the BUN, that is blood urea nitrogen, is 7 to 20 mg per dl. That is the normal value for blood urea nitrogen. Then serum creatinine. Okay, the serum creatinine normal value is 0.9 to 1.3 mg per dl. Then serum protein normal value is 6 to 8 mg per dl. Then serum cholesterol level is up to 200 mg per dl. Okay, but here in the blood test we will find that there will be increased amount of serum creatinine, serum protein, serum cholesterol, and blood urea nitrogen. So this is the diagnostic evaluations which we can go for the nephrotic syndrome. Now we will see the complications of nephrotic syndrome. If it is not treated in time, what can happen? What major complications can happen? Okay, so first complication can be hypovolemia, because the extracellular fluid is leaking out. It is coming out of the cells. Okay, so there will be low volume in the blood cells. Okay, or the body cells also. Okay, so the person may suffer from the hypovolemia. Then there can be renal vein thrombosis. The veins of the kidney get thrombosis. Okay, then there can be permanent or temporary renal failure. The person can also have cerebral edema. Okay, so these are the complications for the nephrotic syndrome. Next we will see the management. For the management, first we will go for the medical management. In this, first one is antibiotic therapy. Immunosuppressive therapy. And diuretics. Okay, so in the medical management, first we will go for the antibiotic therapy. Antibiotic therapy here mainly include penicillin or penicillin derivatives like drugs. Then other therapy we can use here is immunosuppressive therapy. Okay, here mainly we use the steroids. Then another can go for the antihypertensive drugs to control the increased blood pressure. Then also we can give diuretics, okay, such as Lasix to eliminate the extra body fluid. Okay, so this is the medical management. Next we will go for the dietary management. In the dietary management, what we can do, in the dietary management we have to give high protein diet, high carbohydrate diet, and low sodium diet. Okay, so this will be the management for the nephrotic syndrome. Next we will see as a nurse what we can do. So as a nurse we can go for the nursing management here. Okay, so in the nursing management what you have to do, first one is we have to monitor intake and output. Okay, how much amount of fluid the individual is taking and how much amount of fluid individual is passing out, that have to maintain through the input output chart. Next we have to check the weight regularly, because the person will be having increased body weight. So we have to assess how much weight is increasing. Next, we have to maintain the blood pressure, and continuous monitoring of the blood pressure should be there. Then also continuous monitoring of the respiratory status should be there. And so decrease the edema, we have to give the diuretics, and to reduce the edema we can also elevate the legs of the individual so as to reduce the edema. Then we have to promote good hand washing and maintain the hygiene, and main thing is we have to go for the prevention for infection. And the last, we can go for the nursing diagnosis. Okay, nursing diagnosis here can be fluid volume excess. Okay, the first nursing diagnosis can be fluid volume excess, another can be impaired skin integrity, the next nursing diagnosis can be imbalanced nutrition and the risk for infection. Another nursing diagnosis also can be there, like active intolerance, anxiety and knowledge deficit. Okay, so this was all about today's topic. Thank you.